Hi, everyone. My name is Dr. Chee, and I want to talk about how a quote unquote stiff upper lip can actually be contributing to pain. And before I jump into that, though, just to give a brief disclaimer, obviously, this is for informational purposes only. Any questions or concerns, please seek guidance from your medical or mental health professional. So, I was working with a patient today, and I thought what came forward was really worth discussing this question of the stiff upper lip and what happens. So we were exploring her relationship with neuropathic pain, and I asked her how she was feeling towards the pain, and she remarked how she was aware of a part of her that was saying that it wanted to ignore it. And we talked about that more, and what came forward was how she was raised in this family where you aren't supposed to talk complain, talk about how you feel. And there was really good reasons for that, based on her family's history and what had gone on. And when we got to this place where this part of her, or aspect of her personality felt really understood, and it could feel her open heart. When that happened, to my patient's pleasant surprise, the pain relieved and it opened up. And she said she could feel like it was like her circulation started to move. And she also heard that it didn't want to cause pain. And we talked and explored this more inside of her. And what came forward was that this part had actually been trying to protect her from feelings of hopelessness about her medical diagnosis. So I wanted to, what came to me with with what happened was this was a great example of something called alexithymia. And what is that? Alexithymia, Alexithymia, in case you're curious, it's a difficulty identifying and describing one's emotions and a preference for externally thinking or externally orienting your thoughts. And research has shown that this is much higher in people with chronic pain, and that it's related to higher levels of pain. So this is an example of like a part that is this quote unquote stiff upper lip of, for good reasons, not wanting to look at it, but that it actually could be contributing to pain, and but that it's not doing it for no good reason, but that it's trying to protect us from deeper, more sensitive feelings and emotions. And what I was really enjoyed about witnessing this for this patient was that when she came into a heart-based relationship with it, that part relaxed and it relieved pain as well. And to me, it's just such a great example of just in life, when we feel connected from the heart, we just feel better about things. So I thought this was a great example of that, and I wanted to share that with you all. Thank you.